It's really unfortunate, but a lot of health issues we see today start in the mouth, and they're the direct result of actions taken when in the dentist's office, from mercury fillings to root canals. We may have made the choice to receive dental treatments that years later affect our overall health. Today, we're going to find out what can we do to reclaim our health even if we've already made those choices. And then it's going to start in your mouth. This is the story of Biological Dentistry 2.0 with Dr. Dominik Nischwitz, aka Dr. Dom. I know you as Dr. Dom. The last name is always a little difficult for some. But hey, man, welcome back. This has been about 3 years ago we recorded the first one.
Thanks, Casper, for having me again. Yeah, talking about biodentistry 2.0 or 3.0 or whatever. Optimal health starting in the mouth, right?
It's 2.0 because 1.0 was all about your book. It starts the amount, right?
Okay.
And that was really a introduction to biological dentistry. And listen, I got a lot of great feedback from that one because people didn't know that so much of their health issue could start in their mouth. But then it was a lot of people saying, well, I already had these things. What can I do? Because I didn't know. I can't prevent it now if I already had it. So what can I do? So I came to you with this idea of I'm just going to like throw these different things and questions I get at you, and you could just answer them so that people hear it, not from me, because I'm not the expert, you are, but from you. So I wanted to start with a big one that so many people have undergone, and that's, so I've had mercury fillings. What do I do to negate that? Like, how do I start to reclaim my health if I have mercury fillings in my mouth?
So first of all, whatever information we share in here, don't freak out. There's always a solution.
Always.
And I actually love the format you're just putting out here, because same happens to me that, okay, what can we do now if we have it? So first of all, why are you still having mercury fillings in your mouth? That would be number one filling, because the number one question, because the second question I always get is, can I coconut oil pull while I have mercury fillings in my mouth? So first of all, obviously mercury is the most toxic non-radioactive element known to man. And finally, dentists are allowed to say that it's mercury fillings, not silver fillings. And this stuff is outgassing. But don't freak out. The most important thing now is your strategy. I would say, why still have it? You should find a skilled biological dentist. In the US, there are some called, they are SMART certified. S stands for safe, and then mercury amalgam removal technique. Because the mercury filling, while you're wearing it, it outgasses a little bit. So there's a little bit of mercury coming off from, let's say, acidic drinks and foods, from brushing, from grinding, from oral hygiene, from all these things, but it's in the nanograms. However, if you go to a regular dentist to just take out these mercury fillings, they will do it without any safety. Therefore, it's not going to be nanograms, but probably grams of mercury landing in your system. So you first have to find the right skilled biodentist who knows how to remove safely. And I have a safe amalgam removal checklist. You can find it on Instagram. You can present it to your dentist. It's a straightforward approach. Like I just talked to Casper about it, I'm in the midst of finally giving my knowledge to other dentists and a certification. But we need a couple of things. We have, I would say, at least 6-fold measurements. Maybe it's too technical for you guys, but find someone who is SMART certified. It's not just a rubber dam. You know, special suctions. We even help your body detox with the right protocols afterwards or beforehand, and use whatever is possible to not cause more harm. That's basically it.
Yeah, and that's a big one, I have to say, Dr. Dome, because so many people just heard, hey, I have mercury fillings, I got to take them out. And then they go and suddenly take them out without the SMART procedures, and that gets released, and suddenly they have really big problems. So it's really essential you do it the right way, in the SMART way, in both, the SMART, that technique, and SMART using your brain to do it, because otherwise you could actually end up worse off, right?
Yes, I've seen so many patients that come to me, like, let's say 10 years ago, most patients came very, very chronically sick. Now, actually, our patients are more like you and me, people that are on their journey to optimal health. But anyways, I've seen a ton of patients having when their chronic illness started was actually right after taking out mercury fillings in an unsafe manner, intoxicating them full blown because the immune system was already on the edge. And then this drilling But all the stuff that you then swallow gets into your intestines. It's just way more than just wearing them. So before you find someone who is skilled, don't remove it. Invest in detective work, and I'm on it training them.
Good advice, and I'm glad you're training people because we need it. You know, I hate going against dentists because I think they're all good people, right? They're good
we need
people.
them.
We need dentists. We just need them trained a little bit more to move beyond things like mercury fillings and silver and going into more of a holistic viewpoint. So I'm really happy to hear that. You know, if we move along to the next subject, which is a big one. And I actually had this recently where I was around a table with a bunch of people and at least half of them had this procedure. So, and they said, okay, so I've had a root canal. What do I do now?
It's so funny because I get the same question all the time because I'm informing about root canals. Yes, again, there is a solution for you guys. Don't freak out. A root canal works for biting. A root canal is an acute pain treatment, and all the dentists that help you with it, they're actually not to blame. It's a very skilled craftsman, fine art that you need to get you guys out of acute pain. It's actually on you that you let your teeth rot that way. Yeah. So first of all, you now have a root canal. You know that it's maybe toxic and that it's not something that we use long-term. What we do is an immediate ceramic implant. Immediate means we take out an infected tooth, even with a huge cyst, but we have a special protocol where we basically prepare our patient at least 2 to 4 weeks prior to the surgery with the right nutrients to boost their immune systems, so that you come in like not in hibernation mode, but fully in anabolic mode, so to speak. And then locally or in surgery, we use everything: intravenous nutrition, hyperbaric oxygen, low-level laser therapy, whatever you can imagine from health optimization or biohacking, we will use to help. And locally in the socket, when we take out the tooth, we will use ozone. We will draw blood to spin it and make PRP membranes. We clean as perfectly as possible, use neurotherapy. But then if that socket is clean and the cyst is gone and all acute inflammation is gone, everything is basically clean and sterile from the ozone, then it makes sense to put something into that socket, which we call in dentistry socket preservation. But we do socket preservation 3.0 using an immediate ceramic implant, which then acts like a tent post that with a neutral biomaterial that keeps that socket, the anatomy, intact. Because if you don't use it after taking out the tooth, you lose it. But why not put something in there which is totally neutral and help that anatomy? And now finally, after 10 years of doing this, the studies we're doing are catching up, and it shows that we're actually preserving bone height and width with it. So within the next 10 years, this will be the gold standard because you actually help the body heal and recover way faster. There's never really a surgery, but it's never about the implant. It's about getting you in health first. And then we use biomaterials like a ceramic implant, which is a zirconia implant, just as a tool.
Would you ever would you recommend people get a 3D cone scan prior to this? Or are you just going and saying, listen, there's always an opportunity for infection, so let's just attack it even without the cone scan? Or do you do both?
Both. So first of all, obviously, we use logic. I always ask 3 questions to the patients, or everyone actually. Any metals in your mouth? Any root canals? Stand up. Any removed wisdom teeth? Stand up. And usually if you answer with a yes, there's ongoing chronic inflammation in your body, in your mouth that interferes. So what we do is, if you want to become a patient, you always apply online remotely, because most patients fly in from all over the world. And we need not a cone beam scan, not the 3-dimensional one, but we need a current up-to-date panoramic x-ray, the 2-dimensional one where we can see all stuff, metal root canal cavitations, and we always plan the full case, no metals, no root canals, no cavitations. When in the office then, like when you come to the clinic on the first day, obviously we do the perfect examination. So everything up until that point was preliminary, but with a, let's say, 90+ right direction. And then obviously we use a cone beam scan to really see it 3-dimensional. And if you look at studies, but also from just experience, and look on a cone beam scan on the tip of the root of root canal treated teeth, there's always an inflammation, at least in 90% of all cases. Always. It's always a dead body part. So let's say this: if you have an immune system, there is a chronic inflammation. Otherwise, your immune system is like not working properly.
Right. Otherwise, something else is a big problem.
Yeah.
You got to look at
True. Cell
really
danger.
big.
Cell danger, man.
The third one is actually the third question you asked when you get people stand up is, so you've had wisdom teeth pulled, which is, I would say, probably the least known. People know about mercury now. They somewhat know about root canals because of, documentaries like Root Cause and others, and, more talk about it. But wisdom teeth pulled still seem to be, what's the problem with that? What would you say? What's the problem with having your wisdom teeth pulled?
Yeah, why do I ask the question, have they had your wisdom teeth pulled? Because that's actually normal in the Western world. I would say at least 80% of all teenagers get them pulled because we grow too narrow and have no space for our wisdom teeth anymore. The problem is the surgeon will only inform you about the surgery and the pain meds and how to treat with swelling and everything. But you will never be prepared for that surgery, meaning you, as a teenager, going into a surgery unprepared, usually lack of nutrients, critical lack of vitamins like vitamin D3 and critical minerals like magnesium, zinc, boron. You basically in a hibernation mode when going into surgery. So what happens is we are trained as oral surgeons to really be fast because only then insurance pays for it. So for wisdom teeth, general anesthesia maybe, super fast in teenage years leaves a huge trauma. You're not prepared for the trauma. So basically the host is the problem. You're in hibernation mode, you're in shock, you're in fight, you're in stress mode, your body won't heal. It's just not able to heal. That's why a lot of patients develop dry sockets. It's just a nasty part of like ongoing antibiotics, and it just really doesn't heal. And over time, the gum heals on top of it, but the bone never really fully recovers and turns into something called ischemic bone disease, or in layman's terms, called cavitations, which better is known in medical world as NICO, which stands for nico-neuralgia-inducing cavitational osteonecrosis. Or even better, what it really is fatty degenerative osteonecrotic jawbone. This is something you do not learn as a dentist in university. It's part of my curriculum. If there's any dentists out there interesting. But this is why you said, why do you ask that question? Because chronic inflammation of the jawbone is the same principle. Innate immune system response, chronic cytokines, TNF-alpha, interleukin-1 beta, NF-kappa B, all these things, systemically 24/7. Chronic inflammation is the trigger to all sorts of chronic diseases. And therefore, we need to know about jawbone inflammation, cavitations, removed teeth. Actually, wisdom teeth is the ones that are pulled most, but it can happen after every tooth extraction.
So to those that have had their wisdom teeth pulled, what do you say to that if they're sitting there going, well, it already happened, Dr. Dome. What do I do now?
It's all fear-mongering, Dr. Dome. What should we do next?
Stop scaring the people.
I don't scare. I'm just informing.
Of
and
course.
It's actually good because our goal is like in the movie Root Cause.
Yep.
If you are already optimizing everything in your life, your lifestyle, your nutrition, your sleeping hygiene, you go outside in nature, grounding, biohacking, all the things, but you're still not superhuman, like the guy in Root Cause, which is actually your patient, right? You refer to.
Yeah, Fraser. Good buddy. Yeah.
Fraser, yeah. And it was just a root canal. Same can be for the cavitation. So first of all, again, just use it as information. Oh, wow, I had a wisdom tooth removal. Oh, my teeth look beautiful. A normal dentist doesn't know about cavitation. So maybe we're overlooking something here. And if you look at the wisdom tooth area from a Chinese medicine perspective, this is your central nervous system, your heart meridian, and your small intestine. So a lot of times it's connected to skin eczema, acne, irritable bowel syndrome, and chronic fatigue, thyroid issues, you name it. So what can you do then? It's the same as with the root canals. You apply for an appointment, and at one point we need to make that chronic inflammation in the jawbone acute again, so your body will heal it. Because basically your body had no solution. Turn the volume down. Do you have no pain at the area? So pain is really a bad indicator because chronic stuff doesn't hurt. And we then it's a tiny surgery actually, just opening it, local anesthesia and cleaning it out using piezo surgery. And again, the protocol is always cleaning mechanically, then using a lot of ozone because it's antibacterial, antiviral, antifungal, antiparasitic, and as a miracle molecule supports your own innate healing. And then before we draw blood, spin it, make PRP membranes, put it into that cavitation and close the gum. But most importantly, and this is what I believe is the next level of biological dentistry, which I call biodentistry, is then overlapping it with functional medicine and biohacking or health optimization, meaning we prepare our patients for that surgery. Because just doing that locally perfectly doesn't mean your patient is in anabolic mode. You're probably not even prepared. So nutrients are key. The bone healing protocol, food design, this is all the next level and stuff that's going to be taught soon. So stay tuned. It's solution.
It's so true that you can't just go into any procedure and expect a great outcome without preparing for it, without getting your body ready. It's like going into a competition for something athletic and doing no prepare, not going to the gym, not running, not being ready for it at all, and expected to get a good outcome when you race the race or something. Yeah.
You go on a bodybuilding show, but you forgot to diet. Yeah.
Yeah.
What the hell? You will lose. Yeah. You won't win. Exactly. That's a perfect example. Why are we not informing our patients about overall health optimization? Why are we just having consent about the procedure?
Right.
And why are we not thinking further? So what I'm teaching usually for dentists is local cleaning, everything, local bone growth. This is what we always talk about in ceramic implants, in surgery. How can we grow the bone and stuff locally? But what about systemic bone growing? This is where the bone healing protocol comes in. This is where bodybuilding actually comes in, and nutrition. There's great studies from other surgeries. For example, Framingham osteoporosis study showed that people that ate a little bit less, it was only about protein and healing. So it was a huge cohort study. And so 1 gram per kilogram seems to be the ideal number for being anabolic or not anabolic. So below 1 gram, they had 30 days longer of hospitalization, for example. So we always recommend not just 1 gram, but 2 gram, because the literature is quite clear. We need a surplus. And therefore you heal in warp speed because it's just science. You just have to use the knowledge we have. How does your bone grow? What about vitamin D3? What about calcium? What about osteocalcin? What about insulin? What about all these hormones? And this is obviously something that is my specialty in the world of biodentistry. And I'm needing to bring this to the table because 80% is this. The surgery is great. You need this, but if you can come in clinics that do all, it's way better, or work with one.
Yeah.
So that's the future, I believe.
Oh, yeah.
Make that post-anabolic.
Yeah, it has to be the future. Otherwise, we're kind of playing the losing game, where we're 80% we're forgetting about and focusing on the 20 that really doesn't produce the results, which is crazy. It's just crazy talk. So,
but still, you need that 20%, which is great, because then you see, I'm talking about next level also for dentists. We're not taking something away. We're just finally improving the game.
And that's all we should be doing, is trying to be more efficient, get better outcomes with something we're already doing, and then optimizing that as well.
Exactly.
Moving on to something that's very, very, common when you go to the dentist. So you're told you have a cavity, and the dentist says, we got to drill right away. What would you say to someone as a second opinion if you're told you have a cavity? What should someone do? Look for a second opinion, freak out and get the drilling? Like, what do you do?
This depends. So a skilled biodentist obviously classifies the cavity in how deep is it. So if it is, so the outer part of your tooth is called enamel, and the enamel is the hard thing. So if you have initial tooth decay and it's still in the enamel, then I personally would never drill, because we know that if we support our body now with lifestyle, nutrition, and then we can reverse it. Because basically the tooth builds itself through the blood supply, which is from the pulp inside out, and then has this dental fluid, but it also comes through the saliva. So if the saliva is rich in minerals and nutrients, you remineralize all the time. But therefore, as a biodentist who is trained, you will then give your patient the recommendation. You will get the recommendation as a patient. Oh, can we check your vitamin D3 level, please? It's probably low. And what does your diet look like? Because it's quite clear that if you have tooth decay, that you either have a vitamin D3 deficiency, or you're gluten intolerant, or both of it, and therefore having lack of minerals overall. So this is the first step. If it's a huge cavity, obviously the ship has sailed, and then you need to fill it and drill it and bill it. So that's what they say. But again, there's always the fear then. But my dentist said I need a root canal. You don't need a root canal. You only need a root canal when you're really in massive pain. The thing is, we are not trained to understand that the tooth can heal itself, even if the cavity is super close to the nerve. But obviously, if you as a patient run around in hibernation mode, like all of us out there, you probably have a tooth that dies. So he's right with you need a root canal. You understand the culprit here? You have to be preparing. So there's the bone healing protocol, which supports the dentin number 3, the tertiary dentin that rebuilds itself. Again, protein is key, vitamin D3, K2, minerals like magnesium, zinc, boron. It's all in the bone healing protocol. But it is something that people forget. They only think about teeth. They need to be brushed. So everyone knows a toothbrush, toothpaste, right? Maybe even oral, like, what is it? Tooth mouthwashes and floss. But how can it be that we are so much better in oral hygiene, but tooth decay is still chronic disease number 1 with 90% of incidence? So something doesn't add up. There's great research showing that our Paleolithic ancestors, they had a lot of tartar and black buildup and stuff, and not really clean teeth. Maybe even like stuff in there. Definitely not white teeth, but they had no sign of inflammation. And they even proved that in one, like 2 years ago in the University of Freiburg, when they just had 1 month standard Western diet, Paleolithic kind of, let's say, paleo-ish food design, 1 month, 100% less inflammation in gum and teeth and everything. So maybe it's your lifestyle and nutrition. But obviously, we are trained to just repair, and the Band-Aid for classical Homer Simpson is just, you didn't brush your teeth, that's why you have tooth decay. You didn't use your floss, that's why you have bleeding gums, and you didn't use your mouthwash. Because if you would have used that chlorhexidine, it would have been gone. Yes, maybe, but it's just a Band-Aid and it's a quick fix.
Yeah.
So work on that overall thing.
We got to go deeper than that. And so much of that starts with the nutrition. We got to look there also. And the decisions we make day after day after day that lead to it. That's how you can reverse. And you can reverse so much of this.
You can reverse. If it's, like I said, if it's huge, massive hole, you probably can reverse it, but you should never go that way. So ideally, let's see it this way. In nature, our teeth are immune against tooth decay. They are hard as a stone. Just because we got soft, because we got convenient, we're sitting around, we don't even eat anymore. We can drink our food. We can even call someone to bring it, so we don't even have to move to get it. So when we were eating, let's say, meat from the bone, and therefore this hard stuff would already clean our teeth, or raw vegetables, it just cleans it. We now eat processed sticky foods and smoothies and way too much, and we got soft, and our teeth got soft. And you can see it is 90% incidence. This is number 1 chronic disease worldwide. And it's 100% reversible. Isn't that insane?
Absolutely insane. And we didn't just get soft and our teeth get soft, but they also got crooked. And that brings me to my next question I hear a lot. So your dentist recommends getting Invisalign. What do you say to that? How are your feelings on Invisalign? What if someone recommends it right off the bat without any other solutions?
I actually personally think aligner therapy is like, he only recommends it, obviously, or she, if you have crooked teeth. So you ask for straight teeth. So then I believe, personally, aligners are the best solution because you skip the metal part. Because you have to understand, when I was a kid in the 90s, I had braces twice, metal braces, the standard ones, but there was no electromagnetic fields. Like before 1995, was literally not existent. But after 1995 and now 2023, it's like, you would build a huge antenna into your mouth.
Yes.
And there are studies showing that it can seriously alter your brain and how you function in this world as a teenager growing up, can make you more anxious. Obviously, this is a central nervous system, and you now have an antenna in the midst of it, which can also, on top of it, have maybe nickel in it or whatever. So aligners would definitely be the better strategy, obviously ideally supported with osteopathy, posturology, and again, nutrition and lifestyle habits that support that growth of that body, ideally.
Is it true? I was talking to a practitioner that a lot of times when you do the Invisalign and when you're getting a reading for your mouth and everything, you're in a position that's usually back, or your head is up, or you're laying backwards, which alters it, which actually can be worse for it if you take that kind of reading of the teeth, and that it should be in a specific, you should be sitting upright and doing it that way. Because if you're leaning back in it, it could actually shift how it is. I don't know. I really just heard it, didn't look into it. Do you have any thoughts on that?
I think what you are referring to is just it's called taking the bite in dentistry.
Yeah.
So how you bite, upper and lower jaw. Obviously, if you lay backwards, your lower jaw drops a little bit. If you move forwards, it goes more forward.
Yeah.
So you should ideally, when taking a bite, but I think most dentists will do it anyway, seating.
Okay.
Unless it's not important. But so I think for orthodontics, I think it's important to do that seated.
Yeah.
So seated, upright, very relaxed, then take the bite. This is how it should be. Ideally, like when you do when it's about orthodontics, it's probably fine. But for example, imagine what we need to do. We have dental repair going on. That means you send in a panoramic X-ray and we plan the full case. Mm-hmm. So besides having metals, root canals, and the cavitations, you obviously had a lot of dental repair done. Therefore, your whole bite is probably completely off. And if your bite is completely off, your whole TMJ is off, and your whole neck is off, and your whole body alignment is probably like adapted to this bite. So what we like to do is use posturology in that phase from initially coming in, where we just do the health optimization, meaning taking that metals out safely, placing those immediate ceramic implants, and taking care of the cavitations and all the healing. Then we have about 4 to 6 months of a healing phase. Let's say this is laying the groundwork for the house build up later on. And then when you come back 6 months later, then you get your crown work, your aesthetics, your teeth, which is then the house on top of it. First of all, it's like the basement. We build the basement, solid foundation first, and then it's always form follows function, so aesthetics last. So in that phase, if you're at least close by, we can work with posturology, which aligns your eyes, your jaw, your hips, your feet especially, and use that time to rebalance everything. And then when you come back for the final crown work, we can put it into a nice aligned system. So the alignment should always, obviously you see we have people in the staff that are osteopaths, they work on these things, but I'm also in that whole online platform that I'm building for the future dentist, the biodentist. I will include the posturology too, because this is also easy to systemize it. You just have to know that it exists and how easy it is actually, and then put it in. For example, in that 6 months, you will have just different inlets in your feet, like the soles are a little bit manipulated to work on that fascial trains. And it doesn't take much longer for your nervous system to get back to normal, to neutral. So just all about the timing, how to use what strategically.
And it's really fascinating that it's a micro to macro. It's what happens here is actually reflected throughout in the macro. And you can't separate the two. So don't think you just have to look at the whole body and the teeth.
Yes, it's just, and actually perfect. It's the micro to macro from the posture, because this is kind of like the thermostat of your bite. Yes. But also this from the micro is the entrance hall to that macro. So if that's a tiny ecosystem, that's the entrance hall. So if that is already shitty, imagine what happens in the gut system in the whole hotel. Like the entrance hall is already bad, you don't usually leave the hotel, right?
Yeah.
So one glance in the mouth, bad oral health totally equals bad overall health. It's that simple. But unfortunately, dentists are kind of still like, they're not seeing themselves as doctors, and doctors never look into the mouth. So this is where we need to build the future dentist. That's what I'm up to. So
it's absolutely where we need to go. This next one is something that I know would probably hit you as a father of 4. So your dentist wants to give your child a fluoride treatment. What do you do?
My child?
Yeah.
No. Fluoride? No. Fluoride is like the longest discussion, I believe, in dentistry. Fluoride in conventional dentistry is standard of care. So the dentist isn't telling you anything wrong here. This is just how we are trained. And it makes perfect sense because, like I said before, we all have tooth decay, we have bleeding gums, and we basically have a problem with our oral microbiome. So the Band-Aid is giving you lots of chemicals to disinfect. Fluoride is a strong disinfectant, and it also has been shown to somewhat strengthen the enamel, but it's not the real way to do it. But it works as I would say Band-Aid makes sense, right? So in biological dentistry, as it's all about optimizing the overall health with lifestyle and nutrition, we obviously not use anything remotely toxic in your mouth, because you have to see the mouth is also the entrance to your gut. and it has a microbiome. The oral microbiome is actually the most diversified one in the whole body and the second largest, which makes perfectly sense. But if you now use a strong disinfectant on a daily basis, you just wipe out and nuke all these good bacteria, which is commensal, which is symbiotic, opportunistic. Not all of them are pathogenic, but you kill it, and therefore this leads to dysbiosis, and also it's just unnecessary. So what we do is we look for the vitamin D3 in the blood work. This should be above 60 nanogram per milliliter. We prescribe the right nutrients, basically how you would water your plants. So you water your teeth, that they are always in a surplus of nutrients. It's my bone and teeth protocol. Mm-hmm. And then we use a fluoride that you would eat, fluoride-free toothpaste that you would eat. Imagine, why would you put something into your mouth that is so toxic that you would never eat it? Yeah, anything that goes onto your skin or into your mouth, you should look at the ingredients. Would you eat it? If it's a no, throw it away. And if you look at the ingredients of conventional toothpaste, I would say 95% of it is a no. Mm-hmm. They put not just fluoride in it. They have triclosan, carrageenan, sucralose, saccharin. They put sweeteners in it so that you don't taste the chemicals, basically. Sodium lauryl sulfate. Lots and lots and lots. And then there's even more worse things like these cleaning, whitening toothpaste would also have abrasives that file down your enamel, making you even more prone to getting yellow teeth and more sensitive teeth. So what we just do is we reverse it and use something that is totally natural. And the good part is there is a natural substitute for fluoride. You don't need to use fluoride. You can use hydroxyapatite. Mm-hmm. Hydroxyapatite is how the teeth is strong in the first place. And obviously vitamin D3 and key minerals and vitamins like vitamin K2 and magnesium are very much important for strong teeth hard as stone.
Sticking to what dentists tell you to use as far as, toothpaste and everything. So you're using mouthwash like Listerine. What do you tell people like that?
You're still using the blue Listerine? Are you crazy? That's what I would tell them. Did you know that Listerine actually, the blue stuff that's everywhere, was marketed very heavily as a floor cleaner for hospitals and stuff?
Oh, wow.
Yeah, which makes perfect sense. Yeah. But then I don't know how marketing worked in this world. They were able to find another solution for it and sell it to masses, because I think every single person on this planet has used this stuff.
Yeah. Oh, yeah.
Because of bad brand.
Yeah, I used to, and I used to listen to the regular dentist. I would go when I was younger and say, all right, it's got to be, you feel that burning, that means it's working right over time.
But actually, if you just measure this, you can measure the pH of anything. And we know that if the pH or acidity level goes below 5, it's not good for your enamel. And I think Listerine is way below 5.
Oh, wow.
Anything that is remotely acidic will, at least for a couple of minutes, or let's say until the saliva is able to catch up, open up the enamel and makes it more porous, and then bacteria and stuff can jump in. So it is actually acidic, and it's so toxic that it's good for cleaning a floor, but definitely not for cleaning your entrance hall here. That stuff should really go into the bin, and easy to use other strategies for it, like more natural ones.
Yeah. Do you recommend more natural mouthwashes or just oil pulling, a combination? What do you recommend? If you're going to throw away the Listerine, what do you recommend then?
That's what I would do. What I personally recommend, or what is in our, let's say, superhuman oral health care strategy, is oil pulling, specifically with coconut oil. Yeah. Because anyone can buy, or probably a lot of people already have extra virgin coconut oil at home to fry stuff. Mm-hmm. And you would just it's a classic Ayurvedic strategy where you just take a teaspoonful of the coconut oil, you put it into your mouth, you swish it around for 5 minutes at least to 15 minutes, even longer. And there's no harm in doing so. It has been shown that coconut oil is antibacterial, antiviral because of the lauric acid. And it also soothes your gums. It is also detoxing and takes out a couple of these anaerobic bacteria and other fat-soluble toxins that might lurk in your mouth. It's basically just a plus for everything. You cannot do anything wrong here. The only thing is you have to do it. And you could also spice it up a little bit. For example, use 1 or 2 essential oils in the coconut oil. Yeah. Let's say you like it fresh, then use a minty one.
Right.
You add a little bit of clove. So there's so many strategies. There's definitely not a use for any chemical toxic mouthwashes that are also known to affect your thyroid, maybe go into your gut system and cause lots of different symptoms, maybe.
On that kind of, on a more vanity level of things, what do you recommend for teeth whitening? Because I get this. So your dentist recommends teeth whitening with in-office bleaching. You know, that's probably not what you would want to recommend, but
yes, definitely. To be honest, I would recommend rather, if you do any sort of bleaching, let the professionals do it.
Okay.
Don't do the tooth whitening stuff that you can buy over the counter, especially not the tooth whitening toothpaste. Because like I said before, there's stuff in it that files down the top layer of your teeth. And what it will cause is that the top layer will stain faster. Also, you get more sensitive teeth. So you have more often you have yellow teeth. That leads to more often using that stuff until you file it completely down, which is really bad for teeth sensitivity in anything. And if you go to a dentist who recommends in-office bleaching or at least home office bleaching, both of it is fine because they at least know what to do. And if you combine that in-office bleaching or home office bleaching, home bleaching with the right nutrition and lifestyle, meaning you prepared your body before to have strong teeth that are not sensitive, because obviously teeth whitening for a little bit makes your teeth sensitive. But if your vitamin D3 level is in check, you have enough minerals to compensate and everything, you don't even have a problem there. So you can do that.
And what about that sensitive teeth? So I get that question. So I have sensitive teeth. Should I use Sensodyne?
No.
No.
I actually don't know about Sensodyne, but probably is a good marketing.
Probably.
Again, as far as I remember, Sensodyne is just a general toothpaste. No, usually sensitive teeth or tooth decay or gum disease or bleeding gums are not a chemical deficiency. It is more often a deficiency of nutrients and lack of building blocks. So maybe you can resort to using a Sensodyne or let's say a GC tooth mousse or let's say maybe even a chlorhexidine if you have like an extreme reading of anaerobic bacteria for let's say 1-2 weeks as an initial strategy, but at the same time work again on key things like eating the right foods, skipping all that processed crap, eating nutrient-dense foods, especially animal proteins or protein at least 2 grams per kilogram. Get your vitamin D3 levels checked. Support your body with vitamin D3, vitamin K2, magnesium, minerals, all these things that has been shown scientifically to build teeth and bones and nice gums.
When we talk about gums, a lot of people say, so my gums are bleeding. Does that mean my dentist says I need to floss more?
This is something where I personally also sometimes get attacked from actual functional dentists because obviously out of context, if I say I don't floss and I don't recommend flossing, it can come across a little bit weird. So let me explain.
Please.
So bleeding gums is again the norm. We all have tooth decay and bleeding gums. But in nature, we have teeth hard as stone and very pinkish, non-bleeding gums. My gums never bleed. Never. But if I personally use a floss and I have no dental repair done, my teeth are perfectly healthy besides the orthodontics, I actually can really get through with that flossing. So I snap through and then I have bleeding gums. So if you are healthy and everything is fine, there's no need for you to brush in between the teeth. It is not correct that interdental tooth decay comes from not flossing. It is a sign of a nutritional deficiency. Obviously, where it is correct, again, if you have massive periodontitis, a lot of dental repair, stuff that sticks in there all the time and your gums are bleeding all the time, yes, then maybe you need to floss until that's finished, until that's gone, until you back to neutral and normal and natural. But then afterwards, a long-term strategy, I don't use any floss. And that's not nasty at all. There is nothing sticking. So if, for example, there would be a piece of meat in between my teeth, then obviously I would use something like a toothpick or maybe even a floss to get it out. But it rarely happens, to be honest.
And isn't it also... Yeah, isn't it also true that most floss, conventional floss, is coated with a toxic
Yeah.
substance to make it slide, and that comes off? So
The glide, yeah, I think there's BPA on it and like estrogenic compounds, xenoestrogens, stuff that you also don't want to have into your mouth. So again, you see, the goal is use that stuff maybe strategically at the beginning, but the long-term strategy is all about your lifestyle. I know it sounds super boring, but it is actually the way to get teeth hard as stone. And for future generations, my kids, we have to actually start preparing our moms in the like before they even get pregnant to support moms, and then teach them how to breastfeed and use breastfeeding as the initial orthodontic treatment, as the initial immune boost, as the initial training for nose breathing, because of a lot of guys out there have crooked teeth and breathing through their mouth. So future should be, there is no more dental repair, but this will take time.
And that's the interesting thing, because it really does need to start with the children at a very young age. Meanwhile, when you take a child to a conventional dentist, you get all the wrong type of information a lot of times, where it is more Listerine, more this, let's do fluoride on them already. Let's, this, and it already starts to set up a future that's going to be hard to be healthy.
Yes. Sorry, my kids. Yes. But again, the problem also, obviously, not to blame the dentist, is our lifestyle. It's just so normal that we feed our kids sugar, processed foods. I think it's in Germany, it's maybe, no, I think it's the same already as in the US. Like processed foods are ruling, fast foods are actually more cheaper. Kids are drinking juices. Kids seem to be not even humans. They're allowed to do everything. Obviously, for me, I'm like, our 80s or 90s pantry probably looked the same. But actually, to be honest, my parents didn't know better. There was no research. They actually thought sugar is probably healthier than fats, because that's what was the agenda in the 80s, right? So I get it. But I have kids and I know better. So obviously, it needs to be the responsibility of the dentist to learn about these things and teach this to their patients. But then also, obviously, patients can come in like, yeah, whatever, and then don't even brush. So this is the difficulty. So a lot of dentists just work with the general population who have never heard about all these things, and they're just like, whatever, I just eat my fruit juice, I drink my fruit juice again and eat the cereals in the morning, and I don't care. And maybe, what did you say? I should brush once a day. Okay, I'll do that. Sounds good.
Yeah.
See,
we need to change that all around. And yes, it's like a parental change. It is a dental change. Like there's a lot of change that has to happen for this to really work. But the end result is like optimal health. That's the greatest result we could have.
Yeah, but that health is defined as absence of disease, and we just have to first make people understand, especially also my colleagues, that optimal health is even existing, and that optimal health is an investment. And this is obviously where you and me are in that bubble for years, because we optimize everything. And obviously, an optimized person would never use any toxic in their mouth. They understand straight away. So yes, and this is also part of that online curriculum, is that change is what we need, but also at the same time, what is the biggest fear of all humans out there?
Change.
Is always, yes, they're afraid of change. Then I'm coming in, changing the whole dentistry game. I'm trying to.
That's why you're so damn scary, Dr. Doe.
Yeah. But luckily, like when I wrote the book, like this is when like the most arrows flew in my, like arrows were in my back from colleagues. But luckily, because I think because I went so, let's say, at least consistent with whatever I did, and never changed the way. Now, finally, it's moving towards the right direction. I think you see that too. Like there is a little bit of a shift. People are thinking more about their health. They want to invest a little bit. So now we have to be there, because the future pay out, like the general dental patient, the general dentistry. I had a lot of talks with dentists the last couple of years before these course, because I'm in that bubble. All my patients fly in. It's more like they're fans. They're preparing for this. This is and I forgot about how the real dentist lives. The real dentist has to see like a ton of patients a day, has no time for them, has really pushed numbers to make ends meet, and then has to like negotiate prices and all these things. So, and also on top of that, no one likes to go to the dentist. So you treat people that don't want to see you with stuff they don't want to have, and they have to sell them on it. So therefore, we have to change how people see dentists. That's why the future dentist is the real biodentist who knows how to optimize. And then the patients, they are coming, they appreciate it. Like when you clinic. So,
no, it's definitely a change in your mentality, sometimes in belief systems that is very ingrained, and that takes time. And we understand that. And that goes through education. That goes through meeting them where they are and educating them slowly about these things. Like, why would you use fluoride? Let's really break it down, like, and see. Like, I understand you've been told it's good, but did you actually look into it and go beyond what you were told? And that starts to at least open the doors. Once you have awareness, you could start to make changes from there. But if you don't even have awareness and you're just like, fluoride's good, I've never heard different. And then you start to hear people like you and be like, wait a second. Yeah, maybe it's not so good.
And then then there's the caption saying like fear mongering. This is
anti-science fear mongering, like this and that. Yeah, I mean, people, again, that's where people don't want to change and get kind of upset because they say, "Don't change. I don't want to change. It's easier this way."
Please. Don't do it. Don't say it, Dr. Dom, even though maybe it's correct.
So I got a couple more left for you before we kind of finish this off. One of them I do hear quite a bit about and see a lot of people trying different things for. So I'm told I have TMJ disorder and pain. What do I do next?
TMJ disorder and pain. Obviously, you need to find, again, someone who is skilled, but ideally combining it with the overall system. Like I said before, TMJ is not only the biting surface, it could also be related to your eyes, could be related to your feet, could be related to your whole posturology. But usually it has something to do with the 3 health killers that we just touched on. Metals with different bite height, various different metals, for example, can also lead to stress, oxidative stress. Your body may be compensated with a little bit of grinding and chewing, because that's a stress relief. But again, then it will tense your muscle. Then it will maybe offset these muscles here, and your TMJ joint is a compromised position. So it's bite, but also oxidative stress from the wrong materials, and maybe even the nervous system from cavitations and root canals. So again, the big picture applies, but obviously also bite in orthodontics. So, but not just bite in orthodontics.
Yeah. And it's a big one. I see more and more people suffering from that and just general pain in that area in the jaw and everything. So you got to be able to look at those things. Just a couple left here. And this one is something you've mentioned quite a bit. And I hear, so I want to take charge of my dental health and overall health. What supplements should I be taking? I know this is something near and dear to you because you have a supplement line that you work with and have created a bunch of supplements.
Yes. So that's actually a good question. Yeah, I created Subs Nutrition already before I even had my clinic in 2014 with the idea of formulating it myself and using only highly controlled stuff and without anything added, not even a lubricant. And there's one specific product, obviously, that I've designed. It's called Bone and Teeth. So this has everything in it. It's kind of like the one-stop shop for hard teeth, but also nice gums. And on top of it, because teeth and bones share a little bit of a similarity with recovery of other strong, fast-growing tissues, your nails will grow faster and your hair too, and obviously your skin. So there's vitamin D3, which is important, K2, minerals like magnesium, zinc, boron, and a lot of activated B vitamins. This is in a very well-rounded complex. You can just check out Subs Nutrition and the whole bone healing protocol. There's also a couple of formulations that evolve around various different amino acids for your neurotransmitters, detoxification, liver phase 1, 2, as well as other proteins for tissues. Collagen is a big one that you should look into because 50% of your body is collagen. Yep. Gum tissue is collagen. Tooth structure, bone structure, all collagen. So huge on protein here. And yeah, but obviously also the other things like omega-3 fatty acids, the basics. You know, the basics.
Yeah. Basics that we usually forget about.
Yeah, because we go into details first. Yeah.
Right. All right, the last one here. It's going to be a softball. So I'm a dentist and want to learn more. When is your course available?
Thanks for that question. So for now, this online certification, I think I don't want to overpromise and then underdeliver, but we are in this week in the midst of filming it, and took me a couple of years to like script everything and make it perfect. So finally, I think we will drop it last week of January 2024.
Oh, nice.
But if you're
coming
interested,
up soon.
It's soon. but it's in the making for a long time. And I'm training dentists for more than 10 years on weekend courses, but I just thought about how can I speed things up and how can I make it into this next level? Because biological dentistry finally is becoming a little bit of a thing. It's still in the 0.001% of all dentists. And biological dentistry means you're just using, let's say, the biomaterials, you know about metals, root canals, cavitations. That's the technical things. But the biodentistry concept is how to meld biological dentistry with functional medicine and biohacking or health optimization using the nutrition, the lifestyle, everything, the future dentist, so to speak. So if you're a dentist, anyways, listening in, go into my IG and there's probably a link to the wait list, because there's already a wait list because people are waiting for that course.
I'm sure they are. And
it's long overdue. I know, guys, but I'm on it.
So tell us where we could find you on IG. I know your handle, and where people could learn more about becoming a patient or learn more about biological dentistry.
Yeah, totally. Ideally, it's always the IG, because there's everything sorted. You click in the link in the bio, you find a tab bio, link to my clinic, the DNA Health&Aesthetics in my hometown, and obviously to that course. But also there's a PDF link where you can get the whole, let's say, the bulletproof oral healthcare strategies as a PDF for free. So there's probably where you find anything. Also the link to my book, various podcasts, YouTube channel. Go there. Dr. Dome1. DRDOME1 is the handle, but you probably link it in the show notes.
Oh, we will definitely link it. And I'm a big fan of your handle and love everything you're putting out there. Continue the good work. I know you had a long day recording everything, doing all this talking, but no, it's getting out to the people and you are bringing them awareness and empowerment, which is amazing.
Yeah, that's the whole mission. I want to help as many people as possible, as you do too. Therefore, I love co-elevation. The next level of dentistry is not old and stinky and like very slow, but it's going to be fun, young and wild dentists. And then I think the platform will also bring in naturopaths and more doctors, because I believe that any health coach should be able to diagnose the mouth and should be an integral part of any journey to optimal health in the future, that we don't forget where it starts.
Absolutely agree with you. And I'm glad we're on that same path together, my man. Dr. Dome, thank you so much for coming back on.
Thank you so much, Casper, for having me.
Yeah, and to the audience, be sure to check out www.dnaesthetics.de for more information, and also SUPS, that's SUPZnutrition.com, for products to keep you on your health journey and keep your teeth all healthy. And until next time, continue writing your own healing story.